Hi, I'm Dr. Ginger Gardner here with the GOG Foundation, and I am so happy to welcome Susan Leighton, the Dicey Scroggins Award winner for the GOG. Hi, Susan, how are you?
Hi, Dr. Gardner. I'm fine. Thank you so much for having me here today.
Oh, so happy to have you, and thank you for taking out your time to speak with me and really for all your work. It's just really a pleasure to get to spend a few minutes together.
Thank you.
I was looking back in preparations for this, and I had to look it up. I think it was about 6 years ago that we first met and had the wonderful happenstance to sit next to each other on a flight back from IGCS.
That's right. I remember that
And I think sorry.
It was a wonderful time coming back from Portugal. It really was.
I think we had the entirety of whatever that flight time was to just really connect, and I really cherished that time together. It was really a lot of fun.
It was, yeah.
So what brings us here today is just really a testimonial to you and to the incredible work you've done in patient advocacy. And I just wanted to give you the floor and maybe express what are one of the top one or two things that mean the most to you in terms of your years in patient advocacy. What has been your goal that you've been trying to accomplish with all of your efforts in this space?
Sure. Last month was 25 years since I was diagnosed with stage 3C. And when I was first diagnosed, I was like most new patients. I didn't know that it was going to take me in the path it's taken me. All I was doing was hoping I'd be there in 4 years to see my daughter graduate from college. That's all I wanted. And once I made it past that goal, I began to realize there was a lot of work to be done in the ovarian cancer arena. There's so few of us surviving this disease for an extremely long period of time that I think it's a challenge for us to really find something else to do outside of ourselves to make this field better and make this disease better for other women. So the two things I'm most proud of are my work in advocacy for the Ovarian Cancer Research Alliance on the National Program for Survivors Teaching Students, which is probably the best educational program out there for young medical and nursing students, nurse practitioner students, and physician assistant students. We take survivors into the classrooms and have them share their stories within a fact-based presentation so that students begin to become aware of what a difficult disease it is to diagnose and what the personal experience of the patients are. So that's the one I'm most proud of. We've reached over 100,000 students since 2002. And right now, yeah.
So right this is for young learners then, for students that haven't yet completed medical school, or
right. They're in there. Most of the medical students are in their third year. Mm-hmm. And we have nurse practitioner students and nursing students as well as physician assistants. And we've even been asked into some of the allied health fields like pharmacy, like radiology, because they realize that their students will come across women who are diagnosed with this disease. So that's the one I'm most proud of. And we're right now, even with the pandemic, we're still able to reach about 10 to 12,000 students a year with this program. So I'm really pleased with my 1,000 volunteers who are out there doing this program every day. The second thing I'm most proud of is my work in the legislative advocacy arena, lobbying to get funding, because we all know funding is what's going to lead to a cure. It's going to lead to detection tests. It's going to lead to everything we need for this disease. So those are the two things that keep me up at night. Those are the two things I'm most proud of. Yeah.
Beautiful and such important work, really. Congratulations.
Thank you.
So we've asked some of our GOG membership, and we've done a bit of a campaign about what does the GOG mean to you? How would you answer that, Susan?
I would answer it in one word: hope. It means hope. It means that there are people that have our back as survivors. It means there are people out there researching for this disease. It means there are clinicians out there working every single day to help us get to a better answer. And that's what it means to me.
Where do you see us in the field of ovarian cancer relative to some of the recent results from GOG trials? Would you like to comment on any of the results that have been born from GOG clinical trials in ovarian cancer over the last few years?
Well, I think it's seen a shift from getting us to a new way of thinking about ovarian cancer. I think we're seeing it more as several separate diseases rather than as one major disease. We're seeing a lot more thought being given to how women are being treated dependent on the cell types they have. A lot more emphasis on genetic testing, on family history, looking at the risk factors for the disease, those kind of things. And that's been a major shift, because when I was diagnosed, it was one size fits all. Everybody's going to get the same treatment and you hope it works. Now it's getting to be a little more personalized, and that's a lot of that comes from the trials.
I couldn't agree more, Susan. Gone are the days of a one size fits all.
Oh, yeah. Yeah.
And I think in the scientific community, we're increasingly realizing how complex the disease of ovarian cancer is.
Mm-hmm.
And whether we break that down based on genetics, based on molecular profiling, based on tumor response to chemotherapy, amongst a number of different factors and demographics of patients themselves. So I couldn't agree more. This is the diagnosis of ovarian cancer can mean a lot of things in terms of the underlying biology. And absolutely the power of hope from the GOG Foundation and the work in clinical trials to individualize these therapies and really accelerate the best outcomes for all patients. So
Definitely.
We're on the same page, no
Good.
surprise there.
Yeah. Yeah.
What do you see as some of the challenges where, as a patient advocate, you have, I would argue, the most powerful voice.
Mm-hmm.
We spend years in school and in training and dedicate our careers to improve outcomes for patients. So we can look at all kinds of bar graphs and data and elements, but to be honest with you, Susan, it's truly the patient voice and the patient that we're really seeking to help. So with that lead in, what would you say as a patient advocate, where your voice probably, I think, counts the most? Where should we be focusing? What do we need to have our eye on as a community to improve outcomes for patients with these diseases?
I think one of the main focus should be on the patient themselves, as you've stated, but educating the patient. What I mean by that is, I know a lot of newly diagnosed women. And when you step into the world of cancer, you step into an entirely different vocabulary, something you're not familiar with. If somebody says clinical trial to you or patient outcomes, you have no idea what they're saying to you. And I think it's incumbent on us as patients and patient advocacy groups to provide education, but I think it's also important for physicians to learn how to address those topics with patients at an earlier point in their treatment. Just introducing those words, helping patients understand what it is they need to focus on as they're going forward. That to me is very important.
What's the best avenue to reach patients with that information? We're in a digital age, but then there's something very tangible about being present together. And how do you perceive the right vehicle to get that education into the hands of patients? And really, some of that is patients that don't even have the diagnosis yet, but need to have access to this information in case they do.
Right. Well, I think using some of the patient advocate groups such as OCRA, Foundation for Women's Cancers, those kind of groups, to provide it digitally, have it available as well as in print, to have physicians have that kind of information in their hand to hand to a patient. Now, I will tell you, when a woman's newly diagnosed and she's handed 30 things at a time, she throws 30 things in the trash can because it's just so overwhelming to her. But introducing it slowly along time as the patient is in treatment is an excellent way of getting the information to her.
Well, that's such valuable information that we can all get behind. And, you give us the perfect segue. This is Gynecologic Cancer Awareness Month. This is September. Yes. I mean, we need to be shouting this from the rooftops, right? Every woman needs to know about these diseases. And so the more that you and I and the GOG, the Foundation for Women's Cancer, OCRFA, and all of us, all the communities and all of us that are so passionate about raising awareness and promoting education get together. It's just the power of our community. So you said it best, and I just applaud you for sharing your time and your expertise with us today in Gynecologic Cancer Awareness Month.
Well, absolutely happy to do it, because we are not going to be able to do this by ourselves. It's something that takes an entire community, and we appreciate all the work that you guys do. We really do.
Well, it's all the work that we do together.
There you go. Thank you.
So in our last couple of minutes, Susan, please share your, did you know Mary Dicey Scroggins?
I met Mary, Dicey. I met her at an AACR conference, and she and I sat in a corner and discussed everything ovarian cancer, talked about survivors teaching students, talked about everything she was doing, came up with some ideas, just kicked around, ways that we can get the community engaged. She helped me a lot in pushing forward diversity in our program, because it was a real struggle for us for a while. And she was just one of those women that when you walked into a room with her, you felt like you were the only one there, and she was there to share information with you. And she did it so unselfishly. And I'm going to miss her, because there's times I'd like to pick up the phone and say, "Hey, Dicey, what about this?" And I know what she would say. Well, go look it up and get started. That's just the way she was.
You're absolutely right. She's authentic, real, and so solid in her perspective and in her generous time to raise awareness.
Yeah,
I couldn't agree more. Do you know what year it was you guys met at AACR?
Oh, wow. Probably 10 or 12 years ago. It's been a while. It's definitely been a while.
So what did it mean to you to receive the Mary Dicey Scroggins Award from the GOG Foundation?
I really appreciated it. I was sorry I wasn't able to attend last year, or this year, but she, knowing that had Dicey's name on it, meant a tremendous amount to me, because as an advocate, sometimes you wonder, am I really doing something here? Am I really making a difference? And to have her name associated with mine just made me feel so proud. It really did.
Well, her legacy lives on through you and through so many passionate patient advocates that have such a wealth of experience and knowledge to share as a community with all of us in research and clinical trials for all gynecologic cancers. So thank you.
Well, thank you so much.
And I believe you were celebrating a special event in the July meeting, which is why you couldn't attend. Do I remember that correctly?
Yep, the July meeting was my husband and I took off on a cruise to celebrate our 45th wedding anniversary and my 25th year of survival from ovarian cancer. So it was a great trip.
We'll see you at the next GOG.
Definitely, definitely.
We'll catch you at the winter meeting.
There you go. Okay.
That's an anniversary to celebrate in every way.
You know it. It definitely was.
Great. Well, it's in the last, my last question to you, is there anything else that you wanted to share today, Susan?
I just would like to encourage other survivors to get involved. It doesn't have to be on the extent that I did it or that Dicey did it, or it just chew out, just take out what you can do. If it's contributing your story somewhere, if it's participating in clinical trial design, it's whatever you can do, do it, because it will give back to you 1,000-fold.
Beautiful. Thank you again, Susan.
Thank you.
Congratulations on
Thanks
your
so much.
award, on
Thank
your
you.
25-year survivor anniversary, on your 43 years
Fifth, 45th.
wedding anniversary, and all your many accomplishments, and especially for this this award from the GOG Foundation. We look forward to many more successful years of partnership together. Thank you.
Thank you so much.
Mhm.